Hi, I'm Dr. Ty Vincent, and this video is going to be about using LDI or low-dose immunotherapy to treat autism spectrum disorders, which includes things that include pandas and what they call PANS, and some of the other associated things, Asperger's, and or like some of the extremely affected individuals too, all across the spectrum, as you would consider. Just a little background. I was a member of DAN, the Defeat Autism Now group, some years ago, and went to their lectures and meetings for a couple of years, and I implemented a lot of the biomedical approaches that many of you who have autistic children are probably using today still, and had some success in certain cases, of course, as many of you may have, and found that in general there must still be a lot of missing pieces of that puzzle. So over the years of continuing to work with autistic children and adults in some cases, it seemed pretty evident, as a lot of the long-time autism doctors have acknowledged, that one of the underlying pathological issues is inflammation, right? That's a word you hear thrown around a lot. Well, inflammation is a product of the immune system in most cases. I mean, if you twist your ankle and it swells up and it's painful, that's one kind of inflammation. That's a little different. These more spontaneous, chronic, unrelenting inflammatory processes are almost always rooted in the immune system response in some way. And the biomedical approach doesn't necessarily address that directly. There's a lot done with dietary issues, supplements, other interventions to try to squelch inflammation from what I see as a downstream perspective. And as I developed low-dose immunotherapy for a lot of autoimmune diseases, things that have always been described as immune-based diseases, and different kinds of allergies, I would work with fibromyalgia patients. Then I started to work with Lyme disease patients a lot. That kind of put LDI on the map internationally as something people became aware of. You could treat Lyme disease with that. It was just a chronic neurological inflammation for many of those people. I had some of those patients with Lyme disease who mentioned explicitly that some of their symptoms made them feel, quote, autistic when their symptoms would come on, and they'd take their LDI for Lyme, and those autistic feeling symptoms to them, at least what they thought that related to, would go away. So then I decided that it was worth a try applying this technique and this idea in the autistic population. And the Lyme LDI was one of the early things I chose to use. On a personal note, I have a child who could very well have been labeled on the autism spectrum. We held him back from kindergarten for an extra year because he just wouldn't do any of the school participatory work, wouldn't make eye contact, wouldn't communicate normally, and I gave him the Lyme LDI, and he became basically neurotypical. And so, this is very near and dear to me. It's very close to my heart. I don't want to get too emotional about it, but I've seen this be effective firsthand. What's different in my own son's case is that he seems to really just need the Lyme LDI. As I've applied this to kids and older, adults on the autism spectrum, and other colleagues of mine, notably Karima Harani and some others who have larger autistic child practices, as we have collectively started to use this tool, it's become more evident that there are a lot of possible antigens that play a role in being the actual immunological target that triggers this type of neurological inflammation. Just to step back for a second, people wonder, well, how could an inflammatory response cause that kind of manifestation in the brain? And what I tell them is, well, if you have a food allergy that causes eczema, you can see it. You see redness and inflammation and flaking of the skin and cracking and weeping, and it's just obvious, it's visible, right? Or if you see somebody with celiac disease, they eat gluten and their gut is just destroyed and they have diarrhea and they have abdominal pain. We have these understandings of what inflammation of an immune nature looks like in other kinds of organ systems. The skin, it's visible. The GI tract, it's very obvious. With asthma, it affects the lungs and the person's wheezing and can't breathe, they cough, right? We can observe those things and we understand them. What happens if that inflammatory process focuses its attack on the brain? And it can be the same things. I've seen plenty of kids on the autism spectrum have dramatic improvements treating them with LDI or LDA for foods. And so that can be an inflammatory trigger. And if it affects the brain, basically what it has in common with all of these different organ systems is it causes dysfunction and problems, for lack of a better term, in that organ system, whatever it's supposed to do. So if that inflammation targets the brain, you get problems with communication, you get problems with comprehension, you get problems with neurological behavior patterns, you get tics and stimming behaviors, you can see hallucinations in some people, and you can see very bizarre behavior patterns, and you can just see what seems abnormal, for lack of a better term, you know, and autism is really just a label. It's a wastebasket to throw a lot of kids into who don't fit the neurotypical mold, we call it now. We didn't need the term neurotypical before we had the term autism. And so it's vague and it's hard to pin down. And that is the nature of immunological problems. So the more I worked with these kids and individuals with different tools, and then the more I've worked with LDI as a tool, I've become increasingly convinced that in the majority of these individuals, the immunological basis, the inflammatory process, is the biggest factor. Not the only factor for most of them. For some of them, if you're lucky, and we have that kind of success with some of these kids, for some of them it is the only factor that we really have to address. And I've had a number of kids where they were doing all of the dietary changes, they're taking a whole basket full of supplements every month, hundreds of dollars, they've done all kinds of IV therapies, they've done chelation, they've done mold detox, they've done all this stuff, and they've seen 10 to 20% improvement is the best they can cite. And then we get involved with LDI and we turn off some of these inflammatory processes, and you see these kids do things they've never been able to do before. Speak in complete sentences. Go out for the school play and get a part in the play. Get their driver's licenses. They stop soiling themselves and having accidents at night. They live a much more normal life, and it can happen fairly quickly. And it's dramatic, and it's heart-wrenching to know that there are so many kids that maybe could get that result and haven't yet. So my goal in doing this is not to be promotional, it's just so that there's awareness that everything you have tried so far for your children, if it has not worked, which hopefully it has, there's something else to try. And beyond this, there have to be other things to try as well. The children that I have seen do the best, it's in no small part because they have parents that refuse to give up. So, some of the antigens, just to go through that list, and it's complex, and there is no way for you to really look at your child and go, oh, he has this one or that one. Include the Lyme organisms, primarily Borrelia, it seems like, but my Lyme mix also contains Babesia and Bartonella, and I can't tell you that it's one or the other, but I think it's mostly Borrelia. Things like herpes simplex virus, things like Clostridia, things like yeast, Candida is actually a very big one. Things like parasites. I have a parasite mix that has 24 different intestinal parasites comprised of worms and protozoa. That seems to play a big role for many of these kids. Foods play a role. Environmental allergens play a role. Chemicals play a role. I have seen HHV6 play a role for one child. It's not very common. Even though any of you who have run those tests on your child, they'll have elevated IgG or other antibodies or markers to HHV6. I can tell you definitively that the tests have no relevance whatsoever. You can run all the blood tests in the world and it will not tell you what's actually afflicting your child. Not in this regard. It'll tell you what may be in their body, but that doesn't mean anything, unfortunately. So the list is fairly long. I have a propionic acid combination. I have myelin-based protein. I have a lot of things that have neurological potential. H. pylori, influenza virus. So as we get into it with the individual kids, what you do first is you have a very long discussion, very specific. Oh, strep. Strep is another big one. Sorry, I left that off. And if you have a child with pandas, that fits that picture. That's actually really easy. I mean, the name tells you what to do. It's pediatric autoimmune neuropsychiatric disorder associated with streptococcus. So you desensitize them to streptococcus and the disease should basically go away, right? And it does. With no need for antibiotics, because it doesn't say it's an infection. It's not PINDAS, pediatric infectious syndrome with strep. It's autoimmune. It's in the name. And we can eliminate that. So, sorry. This is not scripted. None of my little videos are scripted, so I may ramble a bit. But as you get into it, you go through the history and the details and specific things that your child has or your individual in your family has going on. And I have learned over the years of dealing with this in this regard that there are certain things that clue me into certain kinds of antigens. And then the backstory of their treatment, including how they responded to antibiotics, how they responded to antifungals, how they responded to antivirals. Those things are hugely helpful in determining whether the target antigen might be a bacterium or a fungi or a virus. So those are really important elements of the story to give to your practitioner if they're going to try this approach. And then it's a matter of deciding what seems the most likely to start with, and you go down the list until you have all of the bases turned over. And you can see miraculous improvement in many of these kids. So if anybody's interested in more information on that, I know Dr. Karima Harani has done some lecturing that might be available online. I'm going to be speaking at TACA, the Talk About Curing Autism organization, in Costa Mesa, California, October 20th, 2018. This video is being recorded September 28th, 2018. So in about 3.5 weeks, I'll be in Costa Mesa, which I'm very excited about. So like I said, this issue is extremely important to me, and it's a devastating condition. It's actually the condition I enjoy treating the most, just because I know how much of a difference it can make for the children and the families if we can get this to work. So that's it for now. I promise to start making more videos. Jeanette has nagged me enough, finally, that I'm going to make sure we schedule time to do this because I've been absent for a bit. Thanks.